Hi, I'm Dr. Rich. Welcome to my YouTube channel, Very Nice Smile Dental. Today I'm going to talk about what a denture is. So this is a set of upper and lower full dentures. These are just plaster molds that they sit on. So the upper denture, you can see, covers the roof of the mouth. While the lower denture is horseshoe shaped. This leaves space for the person's tongue. So the purpose of a set of dentures is to replace missing teeth as well as missing gums. By replacing the missing gums, this helps give support to the person's lips and cheeks. By filling in that support, it actually helps to remove some wrinkles by stretching the skin a little tighter. The dentures themselves are made out of a pink acrylic, denture acrylic. So it's pink colored, it's got some little flecks of red to give it a little bit more lifelike appearance. And then the teeth themselves are made out of acrylic as well, so that way you have a nice strong chemical bond between the tooth and the plastic of the denture. It helps keep them from breaking off. Prior to the modern dental acrylics, dentures used to be made out of rubber, gold. The teeth themselves were often made out of porcelain. Made them look pretty, but because the porcelain wouldn't stick to the acrylic, they were more likely to chip or break off. And when you wear them, sometimes they clicked. They used to be called plates too at some point. Not sure why, if it's because of the shape, it's round, or maybe because of the porcelain that was used for the teeth. Similar type of porcelain to what fine china is made out of. If anybody knows why, please leave an explanation in the comments. Thank you. How do dentures stay in? So the upper denture, because of how it's shaped, functions kind of like a suction cup. You get a nice seal all the way around. You put it in, press up, squeezes the air out, and it should stick. The lower denture, because of its shape, shaped more like a horseshoe, you don't really get much suction for it. The lower one tends to just find a spot after some work, some use with it. People kind of will find a position where the tongue pushes it this way and the lips push back on this way, and it helps to keep the denture in place, that balance of force on it from the different muscles. With the lower denture, because you don't have that suction cup effect, lower dentures tend to move around more for most people. If that happens, first thing to try to help them stay in would be to use an adhesive. And down the road, if that doesn't help, the more expensive option would be some implants. We'll talk about implant overdentures in a different video. Pros and cons of dentures. Because dentures are plastic and they move around, no matter how well of a fit you get, there's always going to be some movement since there's no attachment between the denture and your gums. They will always tend to move, and because of that, you won't be able to bite as strongly as you could when you had your natural teeth. Also, since they are made out of plastic, acrylic, the teeth do tend to wear with time, and they become smoother, not quite as sharp. Usually at that point they need to be replaced if people are having trouble biting into things. On the plus side, dentures tend to be the most affordable way to replace your missing teeth. They've been around, techniques have been around for a long time. Nowadays they're getting kind of overshadowed with things, implant retained teeth, overdentures, all on four type setups. But these still work for quite a few people. And the nice thing is you could always try this first. If it works for you, great. If it doesn't and they're moving around too much, we can always take it to the next level of treatment. Next step up would be an overdenture with some implants. And the final step would be just a mouthful of permanent implants with teeth that don't come out. The dentures can also be customized. Can have different size teeth, different shapes of teeth, different colors of teeth. Can even arrange the teeth differently. In this situation, this setup is a more youthful setup where the teeth are all kind of different lengths. The two front teeth a little bit longer, two teeth next to them a little shorter, and then the eye teeth tend to be a little longer again. That's more youthful looking, and then a more mature look would be to have the edges of the teeth all even. That's a look because as people use their teeth throughout their life, the ends tend to wear, and then eventually they all kind of end up being the same length for some people. The acrylic itself, general shade is a pink, but it comes in different shades of pink, so we can even go very dark shades of pink to help match the person's complexion better. If someone still has some of their teeth, say they still have their upper teeth and just need a denture on the lower, we can also strengthen the denture itself with some metal, with a metal framework that gets embedded inside the plastic, so you don't see it. You don't see it, but it gives it a lot more strength, so you're less likely to crack the denture. And the same thing can be done for the upper denture as well, where there's a metal framework. You could see it on the roof of the mouth side, but otherwise you don't see it when you smile. And that just helps make the denture stronger, a little bit more crack resistant. To take care of the dentures, what I usually recommend is after you wear them, and so before you go to bed, take them out. Use your toothbrush, just water, brush them all around, just brush all the teeth, because you can still get plaque and tartar buildup on these. Once you give them a good scrub, both sides, all over, then you just put them in a glass or a little dish with some denture cleaner. Those are just some tablets you can buy at the grocery store, the drugstore. It's almost like, and you soak them overnight in that, and it'll leave them nice and minty fresh for you, so when you can put them in the morning, it tastes like you brushed your teeth. Don't use toothpaste when you brush them. The toothpaste is actually abrasive enough, you can scratch up the plastic, and once the plastic gets scratched, plaque and tartar will stick to it, stains will get into all those little scratches. The denture just won't look as nice. A lot of times that can be corrected though at the dentist's office. So today I talked about what a denture is. Hopefully everybody learned a little bit of something. If anybody has any questions or thoughts, feel free to leave me a comment, shoot me an email. Thank you so much for watching. Be sure to hit subscribe and click the thumbs up button. Thank you very much for watching.